Today, patients are not happy with the doctors, and doctors are not happy with the patients. Therefore, something needs to be done. Today's patient-doctor relationship is in problem. We at Indian Medical Association and Heart Care Foundation of India, we analyzed thousands of patients and we interviewed thousands of doctors. When we interviewed thousands of doctors, they said, we are not happy. We are living in fear. When a patient comes to us, all the time we are thinking that if something happens to the patient, if the patient dies, we will be beaten up. And these incidences are increasing in the society. And when we talk to the patients, they say, we are not happy. And when we talk to the patients, why you are not happy, 90% of them said, the doctors don't communicate with us. They have no time, they don't communicate with us. Then we started asking that, why this unhappiness is coming only in the last few decades? Why this unhappiness was not there in the past? So we analyzed, we picked up around 3,000 patients, and we did a survey to find out the cause of unhappiness. And at that time, we went to our Vedic literature to find out types of patients. Then we came across there are 4 types of patients in the society. The first type of patients are ignorant patients. They are not aware of what is cough, what is cold, what is TB, what is cancer. They are not bothered. They have 100% trust in any doctor they go, and they take like a ritual any medicine and they get treated with that. So these are ignorant patients. The second type of patients are informed patients. They are aware of all the diseases. They are aware of their rights. Third are empowered patients. They have a little bit more than information. And the fourth are enlightened patients. Enlightened patients are the one who are all the time, they are carrying their phone. And if you tell them cough and you say, get this X-ray done, they will immediately say, the Google writes something different. They want questions. They want to question you. So the first group of patients, no questions asked, whatever you give is fine. The second group of patients are the one who says, my doctor is the best. But the third and the fourth type of patients, they want explanation of each and everything. They want justification. Why this X-ray? Why you have not gone for a simple X-ray? Why this X-ray is costing 400 and in the market the X-ray is costing 200? So there is a paradigm shift. And in the society what has happened is, types of patients has changed very rapidly from ignorant to enlightened patients. Now we have more and more of enlightened patients in the society who wants to know why. Simultaneously, there are 3 types of doctors. First type of doctors are that I am God. Don't ask me anything. You are not supposed to. If your patient comes to me, I say, you take this. And if a patient starts asking me questions, we say, Doctor, main hu ki tum ho? Am I the doctor or you are the doctor? The second type of a patient doctors are who will tell you, okay, you have 2 choices. Either you can go for angioplasty or you can go for surgery. You choose. And the third type of a doctor is who will spend time, will assist the patient in taking a decision. Now this is the discord. Patients have rapidly gone into the enlightened phase. They are more informed. They want more time. But the doctors are still in the past phase where they feel, I don't need to spend time with the patients. And that is the number 1 cause of miscommunication. That is the number 1 cause of dispute between patient and doctor. Now if you see, in a chapter of Bhagavad Gita, there is a shlok, Dhyayato Vishanapunsa Sanghasto Shapujayate Sangat Sangayate Kamat Kamat Krodho Vijayate. The main cause of anger is non-fulfillment of desires, expectations, and aspirations of the patients. So if a patient comes with a desire or aspiration, if the doctor does not fulfill, patient is not going to take it. He is going to become angry. He may abuse you. He may shout. He may show his irritation with that. Therefore, our first job as a doctor is, if I am a doctor, my first job is patient satisfaction. Health, curing a disease will come over a period of time. I need to live up to the expectations of my patients and heal him. That is my first job. And if it is not done, is there an answer of this? Yes. The answer of this lies in, firstly, in my ancient Vedic literature called Bhagavad Gita. In Bhagavad Gita, Arjuna was in a trouble. He was upset. Why he was upset? He was upset, should I fight or not? So he was in a dilemma. He was confused. He told Krishna that my legs are trembling, my hands are shaking, I don't know what to do. At that particular moment, Krishna smiled, prasanna mudra. He smiled and he told him, okay. And he took his 18 classes, 18 counseling sessions. The first counseling session, Krishna only listened. He did not utter a word. A patient, his listening is the fundamental criteria written in Bhagavad Gita, that if you don't listen to your patient is not going to be satisfied. Therefore, the first chapter of Bhagavad Gita talks about is patients listening. Listen, listen, and listen. And from second chapter, when Krishna starts explaining, Arjun gets confused. That's expected, because patients are not supposed to have the type of knowledge which I have. And from 3rd to 17th counseling session, Krishna in great detail explains to him, gives reasoning, frightens him by showing his Virat Swarup, and then he consoles him by saying, don't worry, if you make a mistake, I am there. And in the 18th counseling session, he revises the whole thing. Therefore, the first fundamental principle we need to learn, and that needs to come back as a better patient-doctor relationship, is that I need to spend time with the patient, explain to him, reason out everything, and review with him. With that, we came out with a concept called ALERT, A-L-E-R-T, which every doctor and a patient must remember the word A-L-E-R-T. A for acknowledge. Acknowledgement means, so I must acknowledge my patient. Mr. Subhash, how are you? And I must acknowledge myself. I am Dr. K.K. Agarwal. I am an expert in this. I have so much years of experience. So acknowledgement. L for listen. Listen means I must spend time to the patient and listen to him. And E for explain. I must explain to him about investigations, about diagnosis, about treatment, about duration. And R for review. I must ask him what he has understood. If I don't review, the patient will say yes, 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 and he will go back and make mistakes. And T, which is the most important, which most of us don't do, is thank you. That means doctor must thank the patient. We expect the patient will thank me. No. A patient has given me an opportunity to serve. Therefore, it's my responsibility equally to explain to the patient and say, thank you for giving me an opportunity. If we do that, ALERT, the patient-doctor relationship